Hey guys, good afternoon. I hope everybody's doing well. I see some of you guys are already putting in the chat where you are watching from. We are going to go ahead and get into this. Oh wow, somebody's watching from Hawaii. Aloha. Okay, guys. I am going to go ahead and get started. I see one person's watching from New Jersey, Pittsburgh, Albania. Is that Albania? It says Albania AL. So I'm assuming Albania AL is Alabama. Is that what it is? Um, Kentucky. Okay, so you guys are pretty much all on the same time zone. Okay, so it's 5 o'clock for you guys as well. Okay. New York. Okay. Oh, I like that name, Chronicles of Vanity Slay. I love that. Illinois. Okay. Florida. All right. Admin. Okay. So we have some administrative questions here. Okay, Louisiana. You guys are an hour behind. I guess it depends on where you are in Louisiana. Right? Or is the whole state? I know in Texas some parts are on our time zone and the other parts are like central. All right, guys. So we're gonna go ahead and get started. Okay, ZZ said I took my test 2 hours. Wow, let me know when you get your results, ZZ. All right, guys. So let's get ready to we're gonna go ahead and get started. Oh, the entire state. Got you, Carla. All right, guys, we're gonna go ahead and get started. If you watched my videos before or been live before, you know how we do, right? Some frequently asked questions here. If you watch my videos before, you know how we do. I'll let you guys, if you want to take a quick screenshot. Well, this won't help taking a screenshot of this. I'll just quickly answer them. So yes, my old videos will still help. Guys, the test is still the same. It's just some added content. Okay. Yes, my videos help with other certifications other than the CCMA, even though it's specifically for the CCMA, foundational information is the same. If you fail the test, you want to double down on studying those areas, right, where you fell short. Make sure you have the study material. Yes, you can get a job if you're not certified, but who wants to do that? You want to stand out, right? Because even if that job doesn't require it, the next one might, right? And the study tips, absolutely. You guys can take a screenshot of that. Also, in the description box, as a matter of fact, wait a minute. Let me make sure the description box has my study tips in it. I have a free download. Oh my goodness, my study tips is not there. I thought I added it. Wait 1 second, guys. Let me add my download. Oh my goodness. I thought I had my study tips in the description box. I'm going to put it in the chat, okay? It's just a checklist. It's just a checklist. Let me just grab that really quickly. I thought I added it to the description box. I do have in the description box, guys, it's just a free download for 10 business ideas for medical assistants. And also, I have a budget sheet there too. So let me just copy this into the chat so that way you have it. Okay, study tips is there. It's just a free download. It also adds you to my email list. All right, guys, let's go ahead and get it started. Okay, what are pustules? Pustules. I'm sorry, y'all. Y'all know I can't talk. What are pustules? What's our pustules? And let me go to this from my phone so I can see the chat. And while you guys are answering that, I'm going to also try to put this study guide in the description box as well, because I see it in the chat, but I don't know if you can go to it from the chat. So let me just quickly put it in my while you guys have a moment to type that in there. Let me just put this in the description box. I just knew I added it. Okay, study tips. Okay, let me go to the next one while I'm trying to do this. All right, let's see. What are pustules? So pustules, those are pus-filled blisters, okay? Yes, I do see some of you guys put that in there. Pus pocket like a pimple, pus-filled like acne. Yes. Pus-filled blisters. Those are pustules, okay? In the last video, I think we talked about papules, which is like eczema, right? So make sure you guys, one thing I want to remind you guys, as you are going through this, you should have a pen and paper, unless of course you're maybe just driving and listening. But if you can, make sure you have a pen and paper out, so you are taking notes, and then you're also making notes on things you need to go find out, right? So you need to make sure you know about these blisters and elevations on our skin, and bumps and blisters and things like that. Okay, make a note. I need to go back to my study guide and make sure I know this. Okay. All right. What supplement may be prescribed to treat constipation? Okay, let's see. What supplement may be prescribed to treat constipation? Fiber. So I did see that someone said laxative in the comments. So yeah, we use laxatives for constipation and to help you go. And if you need to if you have to have something done like a colonoscopy or some other type of colon exam, they'll give you a laxative to clear. But fiber is a supplement. Fiber is what you want to take on a regular basis. Laxative isn't something you want to take regularly, but you want to have a fiber rich diet, right, to stay regular. So this is a supplement. A laxative isn't a supplement, but fiber is a supplement that they may prescribe in order to treat constipation. All right, true or false? A colonoscopy requires informed consent. Is that true or false? Think about what informed consent is. Does a colonoscopy require that? And guys, I did just update my description box, and I put the link for the study guide checklist in the description box. So it is there. The study guide checklist is there. And it does add you to my email list. Yes, that's true. I see you guys are everybody that said true. You got it correct. So yes, informed consent. Remember, with an informed consent, we are signing, or the patient is signing, that they understand the risk and benefits of that procedure, right? This is required for any invasive procedure, right? Okay, what is an endoscope used for? What is an endoscope used for? Exactly, Melissa, because it's an invasive procedure. Exactly. What is an endoscope used for? An endoscope. Okay, see the answers coming up. Okay, all right, let's see. Yep, to examine the inside of an organ or body cavity. Now, do we need, I'm just going to put a bonus in there, guys. Do we need an informed consent for endoscopy? So if a patient is having an endoscopy done, they're having a procedure where that camera, you guys did say you got that right when you said they use the camera to go inside, right? To examine the body. Do you need an informed consent for that? Okay, yes. I see you guys. Yep, yes. Okay, yeah, I got it. All right, guys. What's the purpose of a living will? What is the purpose of a living will? Give you guys a few seconds to type that in. Living will. I know this definition is kind of wordy, so I'll give you guys a few moments to get that typed in. Okay, I see the answers coming up now. Okay. Okay, all right. All right. So it indicates a patient's wishes regarding life prolonging medical treatments, right? So a living will is a type of advanced directive, right? And it indicates a person wishes. So they may, authorize a power of attorney, right? They may have a do not resuscitate order, DNR, meaning they don't want to be resuscitated, right? So that's a living will. It's a type of advanced directives that indicates their wishes regarding life prolonging medical treatments. And in this case, that they can't make that decision anymore. All right, true or false? A potassium level of 4.5 is normal. Is that true or false? So again, make sure you guys have a pen and paper. So you make sure you know those. Make sure you know your blood level ranges. All right, let's see what we got here. Okay, I see the answers. Okay, ZZ put the answer in there. Yes, 3.5 to 5 is normal for 5.1 for potassium. 3.5 to 5.1 is normal for potassium. Make sure you guys know all of your blood ranges, and I'll tell you which ones you need to know. I do have a video on this already. It's called Lab Values. It's on my channel, but you got to make sure you know glucose, potassium, sodium, PT and PTT. You have to know what else? What else? Potassium, sodium, glucose. Um, it's on my video. Just check out the video. It's a kind of a recent video. You'll see it, guys, but it's called Lab Values. So you can check that out for all of the lab values you need to know for the test. And that's any of the tests. All right, true or false? Diagnostic test orders must be entered using the CPOE by a provider. I forgot what this is called. Computerized. Oh my goodness, I forgot what the CPOE stands for. Do not hold this against me, guys. This is a newer term that they added with the 3.0 version, and I cannot remember what it stands for. I know it's computerized order. Um, Somebody put it in the chat if you know. It's easy. You just took the test. You remember what it stands for? This is a newer acronym on the 3.0 version that was not on the this is an example of the added content. So remember I told you guys a test is the same, but they added some stuff, especially being, in COVID, a lot of things changed with telemedicine and all of that. So they added more information about the about like telemedicine and electronic. Okay, yes, computerized physician order entry. Thank you, Keishonda and Derica. Thank you guys. Oh, you didn't have that on your test. Okay, thank you guys. Thank you. So yes, is this true or false? All right, I see a mix of answers, see a couple of different answers. Let's see. So that's false. Medical assistants can. So let me just go back to that. So it says they must be ordered by a provider, not necessarily. A medical assistant can put that order in on the behalf of a provider. And one of the practice test questions that I've seen, it asks if hospital orders. I think hospital orders. I think yeah, it asks about hospital orders. Now hospital orders, it has to be put in by the provider. But like diagnostic tests, the medical assistant can put it in. So that was false. It does not have to be ordered by the provider, but hospital orders do. All right. Which part of the clinical medical record includes information about each body system? Which part of the clinical medical record includes information about each body system? And I'll let you guys type that in there. Let me find this link. I got another link I need to put in the description box. Okay, I see somebody say health history. No times in April. What in the world? Okay, that's weird. Okay, let's see. Oh, sorry, I went back. All right, so if you put ROS, yes, I see one person, Keyshawn, put review of systems. Yes. So that's the ROS, review of systems, when they address when they go over each body system. Okay, review of systems. And that is within that is within the clinical medical record, but that is within the review of systems. And it is, and I think it is under it does go into health history. So you're not wrong by putting health history, but more specifically it's the review of systems. What's the cyto brush used for? What is a cyto brush used for? Okay, see the answers coming up. Yep, for pap. Yep, see you guys put that in there. Yep, for pap smear. What is psoriasis? Can somebody describe psoriasis to me? If you guys see my mouse moving around on my screen, that's because I'm in another screen and I'm trying to find something else that I need to link in the description box for you. So you probably see my mouse all over the screen. Okay. See, somebody says skin condition. What kind of skin condition? Let's see. Yes. So red skin, patches of red skin and scales that have a silvery appearance, right? Silvery or gray appearance. That is psoriasis. I went to school with someone who had um psoriasis and she had it all over her body. All right, let's go. What type of EKG artifact is caused by an electrical disconnection or a detached electrode and results in the tracer moving into the margins of the paper? Why did this not show up? Okay. Yep. Interrupt the baseline. Yep. Yep. All right. Now, what type of EKG artifact is caused by electrical currents from nearby wiring or equipment and results in spikes, small spikes? They look like small spikes. Okay, Mama Merlin, you said you've been watching since last year. Tomorrow's your certification. Okay, you got this. You got this. You got this. You are going to pass. You've had a head start. You are going to pass this. Just make sure hope you have the study material. So Jacqueline, I do have some CMAA material on my channel. There's a playlist. A lot of the information is still the same. So those videos are still applicable, but um there was some added content. So I haven't had a chance to go over to do that for the CMAA yet. Eventually I will. I just don't know yet when. So if anybody here is taking a CMAA, I don't know when I will be able to do more of those videos. I will let you guys know, but I tend to focus on the clinical material, but those videos are still helpful for the new test. All righty. AC interference. Yes, you guys got it. AC interference or electrical interference. Okay. What is a social factor that can influence a patient's perception of their diagnosis? This is another example of some content that was added with the newer version. A social factor that can influence a patient's perception of their diagnosis. A social factor that can influence a patient's perception of their diagnosis. Let's see. Family, personality, or peers. Okay. So family, personality, or peers. I see somebody put age. Those are personal factors. So you guys were close, but those are personal factors. Family, personality, and peers are social factors. And then before I give you the next one, let's look at this next question. What's an example of being influenced by a call to action? So personal factors are age, and then social factors include family and peers. So what's an example of a patient being influenced by a call to action? Okay, I don't see any answers popping up for this one, so I'm gonna just keep it moving. So now this is the one, social media. I did see somebody put social media in the chat. So if a patient is influenced by a call to action, this means that they are influenced by social media, mass media campaigns, or advice from other healthcare professionals. So that's being influenced by calls to action. Okay. Social media, mass media campaigns, or advice from other healthcare professionals. Family is a it was a social factor. How should you respond if a patient asks you about their test results? Yep, I see. I see. Yep. It's common that yep, it's common to get them mixed up. How do you respond if a patient asks you about their test results? It's okay. That's why we're doing this. It's okay. At least I saw that you were right on the right track. So what do you do if a patient asks you their test results? Let's say you just did their EKG, they asked you for the results, or they had some lab work done and they come and ask you, what were my results? What do you say to the patient? How do you respond? Okay, I see answers coming in. I'm going to go ahead and you let them know the provider will discuss their results with them. Okay, you let them know, oh, the doctor being in a moment to talk to you, or the doctor will call you. Now, of course, if the doctor tells you the results to give to the patient, then that's different, because in some instances, depending on where you work, some of you guys may be on here and you may already work in the office, and you may be like, well, I just give them the results because my doctor lets me give them the results, and that's fine, because some practices, you have a little bit more autonomy, especially I noticed with private practices, I noticed I had more autonomy, and I would be able to call a patient and let them know what their results were, because that's what the doctor wanted us to do. But normally, the protocol is to have the doctor explain the results to them, or the doctor will tell you, yeah, you can let Miss Smith know everything was normal, or let her know, her cholesterol was high or whatever. I've even had to call patients on behalf of the doctor and let them know about their, STD results were positive and that we were calling in a prescription, but it was all under the order of the provider. So, again, we direct them to the provider unless the provider has given us authorization to give those results. What's an example of a diagnostic ancillary service? What is an example? Like, what are we talking about? What are some examples? Or you can just put an example of a diagnostic ancillary service. Diagnostic ancillary service. Okay, so I see some answers coming in. All right, so that's like your pathology, right? Your radiology and lab tests. So think about things that we do to provide confirmation of a patient's diagnosis, right? So they might send you to radiology and x-ray to see if you have any broken bones, right? Or, you know, an MRI or CT scan, right? Or lab tests. So think about, when you think about ancillary services, well, specifically diagnostic ancillary services, think about they provide confirmation of a patient's diagnosis or diagnoses if it's multiple. All right, where should the leg electrodes be placed? Leg electrodes. And let me see if I can pull this up. I don't understand why. Is this hidden? This is so weird. Okay, just above the ankles, just above the ankles. So yeah, so I see some people are putting a calf. Now, we know from experience, like actually doing it, we can put that, you know, we can, it's fine, like just below the calf. But the answer on NHA is specifically just above the ankles. It specifically says just above the ankles. And when we do the calf, it's normally below, right below the calves, not actually on the calf. It's usually right below the calf muscle. Alrighty. In which stage of grief might a terminally ill patient be in if he or she tries to postpone his or her death by giving up smoking? Which stage of grief is that? Think about the 5 stages of grief. I know when I went live on, what day was that I went live and did study? It was one day last week. I know we talked about the stages of grief. So in this stage, the person is trying to postpone his or her death by giving up smoking. All right, see the answers coming in. Let's see. Yes, if you chose bargaining, that's correct. So in a bargaining stage, that's when people are trying to, you know, stop whatever is happening, or, you know, they trying to say, well, you know what, if I only do this, then I can do that. You know, they try to postpone their death. Like, let's say a patient is diagnosed with cancer and the doctor tells them they have 6 months to live, and they say, well, let me stop smoking. That's bargaining because you're trying to stop the process. In what part of the medical record does a patient's alcohol, smoking, or exercise habits go? What part of the medical record is that? Alcohol use, smoking, exercise habits, where does that go? They're basically their lifestyle. Where does their lifestyle information go? Okay. Yeah, you guys got it. Social history. Yeah. Okay. What's the medication rosuvastatin used for? What is that? What type of medication is that? And these next few slides, I believe, are all medication questions, I think, or it's either later in the presentation. But I got quite a few medication questions on here because you got to know classification of drugs, and you need to be able to recognize certain medications. What's the medication rosuvastatin used for? Okay, I see some answers coming in. If you put cholesterol, that is correct. Lowering cholesterol. So hint, let me go back to it real quick. You see rosuvastatin? Hint, when you guys see those statins, those are cholesterol medicines, okay? So you'll see rosuvastatin. You might see atorvastatin, okay? The other one is and rosuvastatin, that one is I believe that's Crestor is the brand name. And then you have atorvastatin, the brand name to that is Lipitor. And then there's another one with the L. I can't think of the name, but it's lovastatin, lovastatin. I can't think of the name, but it also ends in statin. So hint, those are blood pressure medicine, the statins. Some our cardiologists, they even refer to them as a statin, Those are cholesterol medicines. All right, what's an antitussive used for? What's an antitussive used for? Antitussive. I always say think of Robitussin because I think we've all heard of Robitussin, right? Everybody here heard of Robitussin? Anybody on here never heard of Robitussin? I feel like that's one of those just medicines that we've all heard of or had to take at some point. Yep, Olar meds. Yep, the Olar meds, Melissa. Good point. The Olar meds are beta blockers, like the atenolol, metoprolol, propranolol. Exactly, those are the beta blockers. They're beta blockers for high blood pressure as well as heart disease. Oh, she said thanks for the hint. You're welcome. Yep, you're welcome. It's a cough suppressant. It's used to treat coughing. She said, thanks for the hint. You are welcome, relatable Renee. Yep, cough syrup. Yep, Robitussin. I always tell my students, I'm like, just think of Robitussin when you see antitussive because we've all had that Robitussin. Robitussin is nasty, but it's like the best cough syrup. Usually the nastiest medicine is usually the best for you. All right, what are antiemetics used for? Antiemetics. What are antiemetics used for? And guys, do me a favor if this is helping you. Do me a favor and like the video. Exit out the chat and like the video for me. Thank you guys. If it's helpful. Okay, I see you guys. I see the answers rolling in. Let's see. Yep, nausea. Yep, to treat nausea. Anti we know is against, right? And then emetic refers to nausea. All right, what are analgesics used for? Analgesics. What are analgesics used for? Analgesics. Okay. See the answers coming in. Yes, to reduce pain. So you guys are doing pretty good with these medication classifications. So I hope you guys are taking notes on this if you didn't know these. So yeah, you got to know these medication classifications because you may see those on your tests. What about anti-neoplastics? Anti-neoplastics. Anti-neoplastics. Okay, I don't see anything coming in yet, so I'm gonna just keep it moving. Okay, so they slow the growth of cancerous cells. Okay, they slow the growth of cancerous cells, yes, like chemo. Um, this is a new one for okay, this is a new one for me. Okay, good. So make sure you add that. So they slow the growth of cancerous cells. Thank you for saying that, relatable Renee, because it's just a reminder that some of these things that you may see may be new. You may have never seen it before. So just make sure um you're writing down this information down. All right, let's see. For what type of test would you need to complete a chain of custody form? Chain of custody, what is that? Why do we need those forms? Shamit Sam says, never caught you live, but I've been watching videos, taking my test. Oh, you're welcome, Shamit. I hope I'm saying it right. I'm just going to say Sam. I'm glad you were able to catch me live. Okay, let's see. I see the answers coming in. You guys hear the sirens in my background? Sorry about that. I am on a very, very busy street. I hear this all day long. And there's a hospital up the street from me. I forgot to tell you guys that last time. When I was live last week, somebody was like, "Is that the police in your background?" I'm like, "Listen, I'm on a very busy street and right down the street from the hospital." All right. So drug screening, parentage testing. So drug screenings, you guys know like your toxicology testing, right? And then parentage testing, like DNA testing. And and I think the next question is about chain of custody as well. It's not yet, but we have another question about chain of custody a little further, a little later. All right, what are some manifestations of anaphylactic shock? Can it be used for patients that were raped? You know what, Kishonda? I'm not sure. Chain of custody, is that used for chain? I know when patients are raped, they get the whole there's a whole kit that they have. They have a whole rape kit for that. But I know it's often done in the hospital, and hospitals, they have their own lab, so everything is done in-house. But I don't know if that will fall under. See, the thing about chain of custody forms is that the purpose of chain of custody, that procedure, is to make sure it's a higher level of you know privacy. Is a higher level of making sure the specimen is quality, making sure it belongs to the actual patient. So like, for an example, you guys know when they have a drug test, when you go for your drug test, and you have to, they tell you not to flush the toilet. You gotta, some places will make you keep the door cracked. Like, they have to make sure this specimen is coming from this person, and they handle it with care. Not that they don't handle other specimens with care, but you're literally signing off everything as you go. And then it also, I don't want to give the answer away because we have a question coming up about this, but it has to be sent off in a certain amount of time as well, which you'll see in the question later. And I say all that to say, a rape kit is I'm not sure if they have to do all that with a rape kit because it's normally done in-house. All right. Yep. So I see some of you guys put some things there. Yes. So hives, shortness of breath, dizziness, throat tightening, blood pressure drops, or hypotension. Yes, I see you guys. Okay, closed airway, throat. So okay, yep, you guys are on it. Yep. Okay. Um. What is hematemesis? Hematemesis. What is that? If you never saw this word before, but you know your terminology, you can kind of figure it out. This is why terminology is so important. All right. Yep, vomit and blood, or blood and vomit. Yep, throwing up blood. Yep, you guys got it. Okay, when should a urine specimen be sent off after collecting for drug screening? So this is what I was referring to when I said there was another question coming up about this chain of custody when it comes to drug screening. It has to be sent off within a certain amount of time. So when is that? When should a urine specimen be sent off after collecting for drug screening? Okay, so it's not 48 hours, but the same day, and sometimes they may have it within 24 hours. So it has to be on the same day. And again, like I said, sometimes depending on the question, it'll say same day or it may say within 24 hours. It has to be sent right away. All right, what type of medication provides a consistent amount of medication over time and should be taken at the same time every day? What type of medication is that? Not the name of the medication, but what type of medication provides a consistent amount of medication over time and should be taken at the same time every day. Okay, let's see. I see the answers coming in. All right, yep. So this is extended release. This is extended release. It distributes the medications at throughout the day. It is extended release. It is designed to release medications throughout the day, and they should be taken at the same time every single day. Every day, same time every day. What does it mean to be a patient advocate? What does it mean to be a patient advocate? Okay, see the answers coming in. To speak and act on behalf of a patient, basically, yep. To speak and act on behalf of a patient, yep. Of their needs and their well-being, yep. To speak and act on behalf of a patient. Okay, with which hearing test do you ask the patient to let you know if they hear the sound louder in one ear than the other? Oh no, that's supposed to say one ear, not on the on ear. Wait a minute. I'll give you guys a chance to answer that, but let me fix that really quickly. I am a perfectionist and I don't like any mistakes. Hold on one second. Let me fix this really quick. Louder in one ear. Okay, let me share this again. Share my screen. Go back to this presentation. Okay, that's better. Louder in one ear than the other. Okay, it's a hearing test. Okay, I see you guys got your answers coming in. So that's the Weber test. So the Weber test, so you got the Renee test and the Weber test. I think on my other video we talked about the Renee test, but the Weber is when you ask if they hear it in one ear. And if they hear it louder in one ear than they do in the other. With the Renee test, you have them to let you know when they no longer hear the sound. So that's the difference between the two. So somebody they did put the Renee test in there. So the Renee test is another one they'll throw in there. And that's the one where the patient let you know when they no longer hear the sound. And the Weber test is when you ask the patient if you hear it louder in one ear than you do in the other. And I see that Zizi said that this was on the exam. You took it today, right? She said, yeah, today, a couple hours ago. And this was on her exam. So make sure you know those hearing tests. Okay, what is myopia? What is myopia? What is myopia? Anybody know what that is? And you guys are doing pretty good with answering these questions in an open-ended way. And this is why I like to do it this way, because when you know this information, you know it no matter what. And so the goal, even though when you take your test, the test is multiple choice, your goal when you are studying, as I always say, this is my number one study tip, make sure you can answer questions in an open-ended way, meaning that you can answer something without seeing an option available to you. Okay, like myopia. If you don't know what this is, then you make sure you make a note of that. So if someone ever asks you what is myopia, you know it's nearsightedness, right? But you don't necessarily have to see nearsightedness as an option to answer it, because you know that myopia is nearsightedness. Okay. And then again, another note to make sure you go back to that area on the study guide to make sure you know those medical terms for, um, disorders dealing with the eye. Okay. A few more, guys. We almost done. A few more. What are some examples of cultural differences? What are some examples of cultural differences? And you can just put one. I don't understand why this is showing no times. Because that's April 2024. Settings. It's on. Okay, let me get back to this. Okay, let's see. Attitudes, perceptions, behaviors, and expectations. So yeah, language is a um languages can vary among different races and ethnicities, but this is more so talking about like culturally. Like when you're talking about like a culture refers to like how you do things, how you see things. So that's what they mean by culture, not necessarily like your ethnicity or your race, but like your culture. So ethics, yes, that's one because cultural difference, like your ethics may be different from my ethics, right? So it's your attitudes, how you perceive things, your behaviors and expectations. Like one of the questions on the practice exam, it asks, it says something like, it says a patient, it's a scenario question because you do get a lot of scenario questions. Let me let this again, guys. I'm by a hospital and I'm on the main street. For an example, one of the questions on the practice test, it says something like, it says, your patient feels like basically like they don't have any hope in the doctor being able to help them. What kind of difference is that? And it's a cultural difference because their perception is that, you know that doctor is not going to be no good to them for whatever reason, but or their attitude or whatever. But that's a cultural difference. Traditions, religions, also, yeah, there. So any type of practices, any type of behavior, so whether it's their religious behaviors, right, whether it's their traditions, yes, those are cultural differences. So it's not really the language. Now different cultures, we have different, terms and slang that we use. So that is in a sense a language, a difference in language, but it's not really language. It's more so just in the terms, or the slang that we use. All right, what's a super bill? What's a super bill? How would you describe what a super bill is? Shelly, are you still here? I know you take an administrative test. I think that was Shelly that said that. Oops, I done went backwards. So it's also called an encounter form. So that's a list of pre-printed diagnosis and procedure codes. Well, it's not a list, it includes a list. So let me fix that for 1 second. Let me see. Let me oopsie, yeah, let me fix that for 1 second. Hold on. Because it's not a list in itself, but it has a list. So let me see. Has a list of pre-printed codes, because I don't want to make it seem like it's a list. It's not a list, but it does include a list of pre-printed diagnosis and procedure codes on it. And what we do is we take that and we're able to fill out the claim form with that. So that's another way it may be defined. But yes, it's also called an encounter form. It has a list of pre-printed diagnosis and procedure codes. So and it's specific to that practice. So depending on where you work, like if you're in cardiology, right, the encounter forms there will have, commonly used diagnosis and CPT codes for that specialty. And and then the provider will fill it out, and then the billing, whoever's in charge of billing, if you're on the administrative side, you may have to do this, but you use that to fill out the claim form. What's the first thing to tell a patient if they call and tell you that they just ingested poison? What do you say? They say they call you. Let me see who's on here. I'm just using Tanika for an example. Miss Tanika, I'm calling. I just realized that I ingested poison, whether they swallowed it or inhaled it or whatever. Was it absorbed in the skin? But they call you, or a parent calls you and tell you that their child just ingested poison. What is the first thing you want to tell them to do? What do you want to tell them to do? ZZ got the whole conversation written out. Hold on. Call. She said, hold on. Call poison control. Yep. So you have them call poison control, or you can call on their behalf. Okay. You can always, one thing I always tell my students, you can always call on the patient's behalf. There has been numerous times where, not for poison control, but emergency room calls, I've had one phone in my ear with the patient and the emergency room on the other phone. And that's because the patient was like in distress and they were alone. And so I offered to call 911 for them and to keep them on the phone until EMS gets there. So you absolutely can call for them, but you want to have them call poison control. And because they're the ones that's going to let them know what they should do. And somebody put, what did you ingest? That is what the poison control is going to ask, because the way it gets treated is determined by what type of poison they ingested. Okay. Now, that was the last one. Just want to remind you guys, I do have a study session on April 20th at 11. And if this was helpful, don't forget to like this video and make sure you subscribe if you haven't already. Now I'm going to go through the chat and see if you guys have any questions. I like to do this at the end because I don't want to hold anybody up. I don't want to hold anybody up. So let me go back up and shout some of you guys out. I forgot how much I have to scroll to get back to the beginning. But I remember you guys were putting your city and states in the beginning. Make sure you like the video if it's helpful. So I did see Hawaii there. I did shout out Kentucky already. New Jersey. Oh, that was it. I can't shouted everybody else out. Let's see. Oh my goodness, I don't even know how to pronounce this. Oh my goodness, is this Kosovo? Kosovo? I think I'm saying it right. Gentiana, am I saying your name right? I'm glad you guys got. Congratulations to you guys that just recently passed. I see some of you guys said you passed. You recently passed. Congratulations and good luck to everybody that is about to take their test. I see Amber says she started a hospital job on the 8th. Congratulations on your new job. Yes, Melissa is going to be posted later. I don't know. You still here, Melissa? I know you asked if it's going to be posted later since you can't take notes. Yes, it definitely, these videos stay up. Let's see. I just want to see if I missed any questions. I'm just scrolling through. Most of these comments are responses to the question. So if you guys happen to have a question, I do have a few minutes to stay on here to answer any question. Let me know. Congratulations, CC. She said, I watched your CMA playlist and passed with a 413 yesterday. Congratulations. All right, let me see. Let's see. I don't think I see any questions. These are just, hopefully I'm not missing anything. I'm kind of scrolling through quickly because they're mostly just all the answers. So let me just scroll on to the end and just see if you guys have any questions. You're welcome, Angelus. I'm glad you're here. Angelus was on my virtual group study. Let's see. Will the study session be? No. That's a good question. Keishonda asked if my group study sessions. No, they're on Zoom and it's very personal. We are on Zoom. We are all on camera. The last one I had, it was 11 of us. So it varies. One group study I had, it was only three of us, me included. It's AM, 11 a.m. April 20th. So no, Keyshawn, it's not on YouTube. It's on Zoom, and it's very everybody's on camera. We just, people are asking questions. They have let me they when you book the session, you're putting in the notes what you need help with so I can be prepared. And it's literally kind of like a class, really. But we're just all on Zoom for 2 hours, and you can ask me anything you need to. We go over different topics. You're welcome, Lisa. Is medical administrative assistant the same as EHR, electronic health records? So no. So medical administrative assistant, depending on what school you go to, you may have to take that class first. But no, EHR, they go more into detail with maintaining health records. Medical administrative assistant is an introduction, but EHR, you go more in detail. Um, you're welcome, Kishonda. Good luck to you, Jocelyn. ZZ says, I have a question. I'm doing an internship at the doctor's office. There's MA told me I can print out blood results and give the patients if they ask for it. Only if okayed by the provider. So this is going to take me back to how your office is run. When I was in cardiology, and I always use that because that was the last office that I worked in full time. When we were a private office, and if a patient asks for their results, as long as we can tell that the doctor signed off on it, it was perfectly fine to give them a copy. But once the bigger company took over, they had procedures that they wanted the patient to go through. They wanted the patients to go through medical records to get the results. So it just kind of depends. So ZZ, find out from, see how things go in your office, because I don't want to say yes or no. Typically, if the providers signed off on it, a lot of times they don't mind, but um, it just kind of depends. Tanika says, I'm so glad I finally caught a live. I'm glad you did too. What time do you typically do them? You've been out of school for 17 years. We'll be testing soon. So it literally varies, Tanika. I have not made a schedule because I've had a lot going on and I had some time today. So I said, you know what? Let me go ahead and jump on. I got it. I got some time. I had already created these slides. So let me see. Today is Tuesday. Um, let me see when I can maybe go live again, because I do have some more slides already made. So maybe tomorrow evening, Tanika, I can't promise, but all I'm saying is I do have another set of slides created. It's just a matter of what day I'm going to go live. I definitely can't go live on Thursday or Friday, but possibly Wednesday, tomorrow evening. If not, maybe on I can't even say, I'll let you guys know. But it kind of varies, Tanika. If you want to join my email list, I think hopefully I have the link in my description, because what I'm going to do, I'm going to start sending out emails when I'm going to go live. If you download one of those freebies in my description, Tanika, it's going to add you to my email list. And what I'm going to do, I'm going to start sending out an email when I go live, but maybe tomorrow, I'm not sure yet. But I don't want to use a schedule and then I can't stick to it. Yeah, you can use Kaplan. Somebody reached out to me today about Kaplan. If you already have it, yeah, you can use it, but I wouldn't recommend going to buy it. Only unless, if you already have it, that's fine. I always recommend getting the study material for the test you're taking. So if you have it, that's fine. Make use of it. You already paid for it, but I wouldn't suggest anybody to go buy it, because I'm very adamant about getting the study material. Like if you're taking the CCMA, you go to NHA and get that study material. If you're taking the RMA, you go to AMT and get that material, right? So, but if you have it, that's fine. Oh, your birthday is April 16th, and that's when you're taking your test. Okay, good luck with that, Melissa. That's going to be a nice birthday present. That's nice. One of my students, her birthday is on April 16th as well. And initially, we were scheduled to take the test on the 16th, but now they're taking it on the 15th. Um, and that was the same thing I said to her, a good birthday present, but we actually moved the test to the 15th. But yep, her birthday is the 16th as well. You're welcome, Patricia. Thank you. Tanika said, I love to join, but 11 a.m. is not a good time for me, but still okay, that's fine, Tanika. I understand. Right now, the Saturdays, every now and then, a Saturday morning works for me to do the virtual group study. But I may in the future I may in the future do a what's the a evening group study session, if that'll work for better for some of you guys. I've joined already. Oh, you did get the notification that I was going live. Oh, perfect. Okay, so you did go. Okay, perfect. And what I'll try to do, I'll try to schedule the live way in advance, so you'll get notified way in advance that I'm going live. So I'm going to try tomorrow evening, because today is the 26th, tomorrow's the 27th, and my goal, I wanted to try to post a video every day this month. I didn't make it. I'm going to try that for April. So maybe I will try tomorrow. So guys, look out for a notification about me going live tomorrow. I'm going to try. I'm really going to try. Because the goal is I want to try to post every day. I just have a personal goal to try to post a video every day, or go live every day. Okay, you got the notification. Okay, perfect. So if you guys don't have your notifications on, make sure you have it turned on. All you do, just make sure your notifications are turned off, first of all, in your settings on your phone. And then there's a little bell beside the subscribe button. When you subscribe, just make sure you hit the bell to turn the notifications on. All right, guys, any more questions while I'm here? I got a few more minutes. Normally I'm rushing off here, but I literally have some time. I don't think I have to pick my daughter up, so I have a little bit of time. Any other questions? Let me know. I'm going to give it about another 30 seconds or so and see if anything pops up. If nothing pops up, I'll go ahead and end it. Thank you guys for getting on here. And you guys been on here with me for an hour now. So I'm so glad you guys were here. You said you can't see the email link. Which link are you trying? Oh, to join my email list. Rona, just let me see if I can grab that link really quickly and put it in the description box. Let me see. Let me go to my subscribe link. Let's see. I'll go right now and get the link for anybody that wants to join my email list. Let me copy it. And let me go to my free, under my free downloads, and let me see, join my email list. And so you probably have to refresh it once I put it in, because I'm just now putting it in the description box. Let me put an envelope. Okay, save. Okay, so I'll also put it in the chat as well. Hopefully you can hopefully you'll be able to click on it from the chat. Rona. I see Sandra asked for it as well. So yeah, I just put it in the chat, but I also put it on the my description as well. But you may have to go out and come back in, because I just saved it. Michelle said I just got here. When this is going? As soon as we end it. So Michelle, as soon as I end it, I would say about a few minutes. I think it takes about 5 minutes to process and post, but literally as soon as I end it, it just takes a few minutes. Where's the link for the Zoom study session? Okay, I'll give you that in a moment, Keishonda. Let me figure out what's going on with that. I was trying to post a little while ago. Oh, you would like to do the study group as well? Okay, let me figure this out. Let me see. Let me go to that really quickly. Hold on, guys. Event details, virtual group study session via Zoom, April 20th. Apply. Save. View booking page. Okay, I got to figure out what's going on, because I'm going to put the link here, guys, but just check back, because for some reason it's showing that it's no times, but I'm clearly making my time available on I'm clearly available on the 20th, and I made it available, and we were able to see it before, but for some reason, it's not there. And I'm going to put it in the description box as well. It's right under join my email list. It's going to say join my virtual group study session. I'll put that in the description as well. And once I end this, I'm going to figure out what's going on. I have no idea. Patricia says, I'm in the process of passing my reading. I took a EHR course, but have to pass my high set. I'm not sure what that is. High set. Is that I'm not sure what that is. I see you have information that's on my study guide. Yes, I'm not sure what high set is. Okay, you're welcome, guys. It's $19.99, so pretty much $20. I made it very reasonable. Just $20 for isn't this for 2 hours of just anything you need help with. Oh, high school diploma. Oh, gotcha. You're welcome, Michelle. You take the NHA Saturday. Oh, wow. Okay. Good luck, Michelle. And have been watching my video. Oh, perfect. 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 I'm glad they've been helping. Let me know once you pass. All right, guys. You're welcome. I don't see any other questions. I'm going to let you go. And Patricia, you said your process of passing your reading. Took an EH, but have to pass and then see. Oh, okay. I see what you're saying now. A lot of the information I had has the information from your study. Okay, I see what you're saying now. I got you. I got you now. Okay, guys, let me go ahead and end this. I'm gonna go ahead and end this so Michelle can get to studying. And I will talk to you all later. And I'm gonna try my hardest to go live tomorrow, maybe around the same time. Possibly a little earlier. I'm going to try. Okay. And if so, I'll see you guys then. If not, I'll see you guys next week. But I'm going to try tomorrow. All right. You guys have a great day.